How you doing? Good, I haven't seen you in a while. Alright. It is now 12 o'clock, so the last of the group is signing in. So if you're here in person, welcome. If you're on Zoom, welcome. Make sure you've signed in. The sign-in sheet is at the door this time and not in the back. And then you should have 3 things for today's meeting. You should have the agenda, the old bylaws, and the new bylaws that are marked draft. And Scott, let me give you this paper. Oh, you know what? I think that charts everything. All right. Oh, and don't forget your organization in the chat, so that way I know where you're at. So again, welcome to our February meeting for the Chaves County Health Council membership meeting. In your big old agenda packet, the second page is last month's minutes. If you could take a look through that, see if there's any changes. If not, I'll entertain a motion.
Make a motion to approve the minutes, sorry.
I have a motion to approve the minutes as written. Do I have a second?
I'll second.
Oh, that was the.
So I have a Dan Nee that's motioned and Dan that seconded it. Makes it easier for my minutes. Any other discussion? All in favor?
Aye.
Any opposed? Motion passes. All right, Rick is not here today, so he sent me his treasurer's report. And so Rick says, good afternoon, which works because it is afternoon now. I apologize for not being able to make the meeting. The first thing I want to do is correct errors I had on the December 2024 report that was given on the 8th. Those changes have been reflected into the minutes that you just approved because we had already done it ahead of time. The current balance for the Health Council as of January 31st, 2025. The starting balance is $158,684.48. The ending balance for the account is $150,252.25. The Health Council, that's the combined balance. The Health Council by itself is $81,290.42. The Health Expo account has $17,709.33. And together with Veterans account has $51,252.50. Any questions on the treasurer's report? Because that's clear as mud, right? All right, then we will move on. We have a presenter for a request for a sponsorship. Is she?
She's not mine.
Oh, Jennifer Gordon, sorry, give me a minute. Have I told you guys I really hate Zoom? All right, so. All right, Jennifer, you can start whenever you want.
Alrighty. Well, I greatly appreciate your time, everybody, and I'm really apologetic that I can't be there in person. I am sick today. I'm sure you can kind of hear it. But my name is Jennifer Gordon. I'm the licensing and support supervisor here in Chavez County with CYFD. That's a fancy title. What it really means is I work with all of our licensed foster parents. We call them resource providers in New Mexico. I work with them through the licensing process and then maintenance of their license. So today, the reason that I am here today to present is to request for funding for our Resource Parent Appreciation event. I believe Miss Eton is in the room as well because this is a joint request between CYFD and CASA because CYFD can't accept funds. It would have to be accepted through CASA. But as the primary person who helps plan this, I thought it was important to be here today to be able to kind of talk to you about why this is so important to us. So we host a Resource Parent Appreciation event every year. And it varies. This year, we are hoping to host in June of 2025 in efforts to retain our resource parents. So last year we were unable to do an event, but we're able to hand out goodie bags. And so this year we'd like to do an event with a dinner. Why is this so important? So today, I looked up these numbers. So today, in Chavez County alone, we have 159 youth that are technically in care. 150 of those youth are placed in foster placements, so placed in out of home placements. Um, 9 of those youth out of the 159 are currently on what is called trial home visit. But over the last year, we've had 214 unique children come into foster care, with 55 of them discharging from foster care. Of those children that have been in care or currently in care, 76 of them are in what are called non-relative homes. So those are in foster placements that are not related to them, and 37 of those children are in relative homes, with about 40 of those other children placed in what is considered other placements, which could be group homes or treatment foster care settings, situations like that. Our resource providers in Chavez County that are non-relative are relatively limited, and that's why it's so important for us to continue to retain them. But just so you are aware, we only have 18 that are considered community homes. So these are homes that are licensed to be able to accept community children. So we are desperate to continue to recruit, but also desperate to retain those that we already have. Um, per our request, as you can see here, we are requesting, I believe, $500 to aid us in the purchase of food and gift items. So when we last hosted an event that was a dinner, we were able to secure items for a giveaway and raffles and such. And with a donation, we would be able to continue to do that and be able to purchase food items. So at this time, the department has not given us a budget. And traditionally in the past, we don't typically receive a budget for this. And so we are dependent on programs like you to be able to help support our retention efforts. I personally have been working with our licensed resource providers for the last 3 years, and I'm committed to the ongoing recruitment and retention of our community providers and relative providers. Does anyone have any questions about what we would like to use the request for?
I don't think so.
So I do have one question. So according to our bylaws, you need to be a member of the health council to request a sponsorship, and you marked that you're not. Are you willing to become a member of the health council if you are allotted these funds?
Yes.
Okay. Anybody else have any questions? If not,
Can I make a motion to approve the $500? And then, we'd love to hear about how the event happened afterwards.
all right, well, so Danny motioned to accept the $500 and then to hear what happened after the event. And that is a requirement, is that after your event for the next health, slow down. That for the next health council meeting after your event, that you have to come and present and tell us what all happened. Are you still good with that?
Yes.
Okay. All right, so I have a motion to approve $500 for CYFD.
Tiffany will second.
Danny, a second from Tiffany. Any other discussion? All in favor? Any opposed? All right, so what happens here is now this will go to the board for the board's approval. So it's still not a done deal yet, but after our board meeting, which is next Thursday, thank you. We'll get back with you on that one. Thank you,
Perfect. Thank you.
All right, so the next thing on our bylaws is, or on our agenda is the bylaws. All right, so. All right, so like I said, there's 2 copies of the bylaws. You have the ones that says revision June 15, 2024. This is the current approved set of bylaws. Okay, and then you have the one that has the big draft through the middle of it. What I did is to make life simple. In the approved set of bylaws, I highlighted where the changes are. Because I don't want to read the whole thing.
Harry's awesome.
So if you go to the second page under Article 6, Structure and Functions of Meetings. It says the Chaves County Health Council shall meet monthly. And then if you go to the draft. What was done was that last sentence, the Chaves County Health Council is subject to the Open Meetings and Open Records Act. That was removed. Because that pertains to government and not us. We have our own set of, as a 501c3, we have our own set of rules that we have to follow. This is the government piece on it. So I'm gonna tell you what the changes are, and then we can have discussion at the end, and then I'll open it up for a motion. Okay? All right, then on the third page, section 3, functions and goals. All right. That one has got the most convoluted changes in it. And it was too hard to break it apart. So that one, we're gonna have to go through each section. So basically, item A and A and B were combined to make the new A. And then the only other things is there was just wording changes. So that. Hang on. Okay, so on D, on the new piece, D, where it says advocating, it used to say ensuring all individuals, we just changed it to advocating. On the old G, which is now the new F, used to say ensuring individuals empowerment, now it says promoting individual empowerment. And one more, it's promoting. Promoting, oh. No, I guess that's it. Those were the only changes in there. Again, those were just little word changes to make it flow better. Page 4. At the bottom. Section 7. Which and the new draft is on page 5. Procedures for making a request for funding and activities as follows. So it combined, A and B into the first sentence. It combined D into one full sentence instead of breaking it out. And item H was removed. On the old one, it says if request is approved, the grantee agrees to terms and conditions of membership and meetings outlined in these bylaws. That was already written in a different place. So if, again, it's just cleaning up the text in that area. And then under section 8, number G or letter G, says contracted staff on the old, we just removed contracted and now it just says staff. So the reality is the only major change in the entire bylaws was the removal of the one sentence about the health council is subject to the Open Meetings and Open Records Act. Everything else was just cleaning up language. Any questions in that big old muddied mess?
Good job.
Yeah. Bylaws are hard to present.
You need a motion,
I need a motion.
and I make a motion, and I'll second it.
Thank you. I'll be sitting there looking at it for a minute. All right, I have a motion from Diane to accept the bylaws as amended. Do I have a second? Motion and a second. Any further discussion? Being none, all in favor?
Aye.
Any opposed?
See the names of the for your, yeah.
No, I'm making notes. And Dan is keeping an eye on the discussion online. All right, so that gets rid of bylaws. All right, so now we're back to your big packet. Next item on the agenda is the 2024-25 budget adjustment. Which is that beautiful, colorful page. So all we did on that one is the monies are still the same. We just were able to break it down. So now that we can track health council budget against the health expo, against Together with Veterans, caring for seniors when they come on board. And then we'll keep going as we add other programs. So that way we can track each programs. This is what I need to be able to apply for grants. Is something that was cleaner. So this was just kind of we had approved it in the meeting somewhere back in the summer, so I just wanted to bring it back. I don't think we need a motion to accept it. I just wanted to make sure you guys saw it.
Looks good.
Any questions on it? Was that a hands up or a thumb?
This is my
Oh,
favorite
glasses.
class of stuff.
Okay,
See the.
all right. Woo-hoo. All right, in that case, we'll keep going. Health council activities, we have grown membership again. So now we're up to 76. Welcome Bruce Burleson. Cannot say that first name from UNM. Michelle Poindexter from UNM, Matthew Rutherford from Fifth Judicial Court. So one thing is the website, the new website is up and running. So now you can see the membership section. It's easier to join the health council. You can see the events. So a lot of this stuff you can now start seeing. And there is a member section on the new website. I just don't know what you guys need access to for yet. But as soon as I figure out what you should have access to, you'll have your own little section. Just gotta figure out what to do with it. We got a letter from the Behavioral Health Leadership Council. I'm sorry, I start running through all this stuff, so if you guys need to slow me down, slow me down. So on the next page, the Behavioral Health has sent us a letter saying that they are ready to partner. We just need to know what the next plan of action is, and of course, everybody that knows anything about this is not here. So at our board meeting next week, we will go through this and discuss what our next plan is, the MOU, and go ahead and get that signed and analyzed or brought together, whatever voodoo we gotta do with it.
So it'll come underneath Travis County Health Council umbrella and will it be its own, like, the transfer?
Yep, it'll have its own budget line.
There's currently no budget, there's no money for that group. So that's why it's helpful to have the health council as part of the umbrella, so that if money is.
So, if I may,
Not the private.
the leadership council, the Behavioral Health Leadership Council in the beginning with Judge Hudson, we were trying to put together training programs for local law enforcement and so on to assist with intervention on the streets. So we weren't doing this revolving door business and trying to get all the players together to present something new to this year's training didn't happen. There was some change in leadership and so on and so forth. So the Leadership Council coming under CCHC, I don't necessarily see it as we understand it from that side as a separate entity, but as a project. We're not doing classic sponsor the Leadership Council while they get their own nonprofit. That as far as I understand it from the judge, that's not our goal. We're happy to work with CCHC and have some of the goals become projects of the council as a whole.
Any other questions? All right, thank you, Dr. Fraga. All right, so we'll keep working on that. So activity updates, so there has not been any meetings for the youth education and awareness or the food insecurity subcommittees that I'm aware of. Diane, you're the chair of the youth education.
We do have some programs that are coming forward and that we have done. One was just Monday night where we have a large group of parents come in, and it all has to do with prevention and education and developing parents to be aware and make smart choices along with their kids.
So,
To do with drugs and alcohol.
but is that under your program through DWI, or is that the new program that we're trying to put together for the health
That's
council?
under the new program that we're trying to put together, working in collaboration with all schools and different entities to build better pathways to healthier choices and education.
Okay, so did you meet with your subcommittee?
I haven't met.
Okay, so
I can be on your side.
we have a subcommittee already established.
And she was at the meeting too.
Is this gonna, the Maze of Life is gonna fall under this?
So the Maze of Life was going away, so we were trying to find a replacement for it. So it wouldn't be an existing program, this would need to be a whole new program for the Health Council.
I believe Loretta was, oh yes, Diana.
Yeah, I'll have to go back and look at my emails.
And what that subcommittee, since, we do more collaboration with the DWI, program, because we reach out to all the youth in the town.
Okay.
And we're making a strong effort to bring in more parents and educate.
Okay, I will,
Mary, this is Loretta. I'm on
Yeah.
my phone, so I'm sorry to interrupt. If you could facilitate a meeting of all the members that have agreed to be on the subcommittee, because I'm extending an invitation for our team to come to Albuquerque to see the next spree event that's being planned by the schools here. You will be so amazed at how effective it was to reach students, the ones we really want to get into, be educated and become aware, so we can get a good baseline of what a quality program looks like. And I'd be happy to get information out to everybody, but being part of this committee and waiting, I had not been contacted at all, pulled a bunch of information together to send into council. And so I feel a little bit out of the loop and would like to remain in it, because I think that educating our youth is going to be key to any of these problems that are going on in Chaves County regarding addiction.
okay, yeah, there hasn't been any other meetings since the one that, that original one that we had way back when. So yes, I will send out an email to everybody that's on the committee to get back together so that we can start
And
organizing.
Gina on that.
All right, the food insecurity, Michelle is not here, Michelle went off.
She gave it up, remember?
Yeah, who'd she give it to?
It was just kind of open.
Was it Evangelina?
No.
All right, so right now, I don't have a chair for the food insecurity subcommittee, but,
I was on it, but I can't run it.
right. Well, what we're gonna do is we're gonna do a food drive in April to collect for the month of April, and then we'll give food up in May. So it'll be like just before summer. So,
And April is public health week, so.
look, all I knew is it was after Together with Veterans Symposium. I didn't have anything major in April. We can do it then.
That'd be perfect.
So as we start putting that together, we will, put that information out. Any questions?
To find somebody to take Michelle's place.
Let me go back through it because somebody that was in that committee said that they wanted to be the chair. Really thought it was Evangelina.
She's, that you wasn't gonna be able to pick up today, so she'd be a good fit.
Yeah, so let me look at that and then I'll go back out to the
Be the
subcommittee.
We'll just go over it on Thursday.
Yeah. Yeah. All right, so the next item on the agenda is the contractor, the director update, which is in a different one. All right, so I'm not gonna read through all of this because you have it, so, but I do wanna highlight a few things. The first being is that, again, the resource survey is out there. I need everybody who provides a service to start filling out the survey so that we can start building up our resources and making sure that we have all the data out there. And it's not just those who provide free services to the public, it's if you provide, say, counseling and you take insurance, you can put your information in there. I prefer, instead of like individual doctors, to try to do groups, because the doctors may go in and out, but the groups usually stay. So that way the information stays accurate and up to date. The other thing that we are doing is that we have the kindness campaign going on. It grows as it goes, which, by the way, is the state motto. I don't know if you know it. It's in Spanish and I don't know how to say it, so. That. Say it again.
Y crecimiento.
Oh, it's in Latin.
That's okay, it's same roots.
It grows as it goes. We're doing a couple different challenges on it. The first one, it's behavioral health, so it's all positive affirmations. It's self-love. I'm definitely working in a whole lot of self-love in here. So post-it notes, post something positive to yourself, post something positive to your neighbors, post something positive on social media. You'll see the Health Council Facebook page is putting out a daily affirmation. So what is today, the 12th? So there's 12 of them out there already. Then we have a group project, and I'm working with schools, anybody who's got large groups. I got my first set of postcards, so the kids can make postcards or cards, and I will trade them out for 5 cards, 1 packet of seeds, so that they can grow some love. And my thought process on this was that they can grow their Mother's Day gifts. So we're gonna spread love out for a couple months on that one. And then the other one is the Kindness Ambassador. And if you sign up to be a Kindness Ambassador, you get one of my lovely pins that I spent all day Sunday making. And some stickers to hand out. So that is, if you see anybody doing something positive, if you're an ambassador and you go shopping and you see somebody holding a door open saying thank you, returning somebody's cart, you thank them for being an ambassador and give them a sticker. You're gonna spread the love. If you want to sign up for any of this, you can do it on the new webpage. It's under events. And so there's a short questionnaire on there at the beginning, so that way I can judge how you're feeling when you start, and then I'll judge you, well, not judge you, but well, I will judge you.
Yeah.
We'll see where you were when you started, we'll see where you were when you ended.
I got 10 postcards.
And I'll get you yours. The other thing that we're working on, and Danny will go through her part of it. If you know of a veteran-owned business, we need to get those businesses registered. That is also up on the website under the Together with Veterans section. Because we're doing a whole veteran resource guide, which will have businesses and resources for them. I also sent out an email with the community stigma assessment, and that's because we're doing the overdose prevention grant. So if you haven't filled out that survey, please get in there and fill it out. If you filled it out already, you can go back and do it again, because now they put the counties in it so they know. I was the first one to send it out, and there was over 100 surveys in there, but they couldn't tell you who did what, and I'm like, it was mine. But now if you do it, they can. The other things is we're gonna have our CHIP public meeting here pretty soon. So I'm gonna have to, that we'll have to bring up. I need to get a group of people who want to work with me on root causes. So we need to identify future policies for root causes. We again are working on overdose training, and that's Emily's program. And she's now trained to be she's trained to do the trainings. So if anybody wants an overdose training, let us know and we'll go in there and do it. She also needs to do some 988 trainings, so we can kind of back them up and do them together. And that almost completes almost everything off of the DOH funding. And you will see all of that in the packet.
Can you let them know of your funding that you accepted?
No.
Sorry.
So there was funding sent out and it was supposed to fund 44 health councils and tribes. But not all of them accepted. So they were able to come back and say, hey, we have an extra roughly $5,000. Would you like it? Yeah, we would. So, yes, we took the money and we ran with it, and we're gonna use ours for coordination support, because we've done the Health Alliance piece. We're working on some 211 stuff. We've got the website, so we're doing a lot of coordinating. And so that's where we're gonna put it, and the rest of it, the other was for travel, and we're good there. Any questions on the DOH? One of the other things, I'm probably gonna send you out a survey, is I kind of want these meetings to be a little bit more than me just sitting up here and reading off what's on the agenda. I'd like to do some trainings, or I don't know, I need stuff. I'm a touchy person in many, many ways, people. So think about it. What would you really like to see from the health council during the membership meetings? And you can always email me before I send you out the survey. But put your thinking hats on, because like I said, I need to feel things. That's it for me. Danny?
Hi, so, first hat, I'm Veteran Service Officer of Department of Veteran Services. This is Ben Mendoza, who is our new VSO, so I have two VSOs in my office, so if anybody knows anything, it's been a long time coming. On the other hat that I wear, actually, I should say something. No, okay, well, he comes to us from workforce, so y'all may recognize. Anyways, on the other hat that I wear together with veterans, I am the coordinator. And I believe last I counted, 2 days ago, we were up to 12, applications that were received. If you don't mind, I'm gonna grab this from you. Anyway, so this is our lovely, like, little awesome packet that, Carrie put together. If you know anybody or an organization that would like to go ahead and have a booth, they can just select the booth only. I'm working on solidifying. We have the presenter Dennis Mohat solidified, we have Goss solidified, but this will be the third annual, Chaves County Veterans Symposium. We are, Carrie and Emily are also working on the Veteran Resource Guide, and that's one of the reasons why we were looking at sponsorships to kind of help cover some of that. Because one I've just put together, over the last 8 years I've been at VSO. So, if you know anybody, know any veteran organizations, please blast them out, call them out, whichever. We do have a Facebook page, and there is more information that's available on the Chaves County Health Council website. There is some of these lovely little files over there, and that is holds the save the dates. And it is gonna be at ENMU State Fairgrounds at Hobson Hall on March 29th from 10 a.m. to 2 p.m. And also we are gonna have the New Mexico Department of Veteran Services. If you don't know, the state benefits department is gonna come down and process tax exemptions and tax waivers that day. Once legislation goes through, because the tax amendments that went up during voting, and they're being presented to legislation, and once those go through, it's gonna be a madhouse to get those, because there's gonna be new certificates, reissues, and everything. So we're anticipating about 84,000 veterans reapplying for that, so, and surviving spouses. Other than that, this day by day, the bus rides that were provided, and you'll see on the very last page, there were 644 bus rides that were provided in the month of January. So, and then, we had 82 personnel with a total of 125 interactions with veterans at the DPS office. And a lot of that every day we're, pushing, 988, we're pushing, what else is there? Gun safety awareness. And another thing, Together Veterans does is we do a quarterly PPR training. So if you're interested, that date is gonna be rolling out.
Any questions for Together with Veterans?
And QPR, for those that don't know about it, it's a suicide prevention, training.
Thank you.
All right.
And free. It's usually $200 a seat.
Yes.
I just wanted to, let you know again how much the veterans do appreciate the rides on Scott and Rockville Transit. And, matter of fact, over the past couple of days, we've had a couple of veterans come up who've lost their IDs. Give you IDs. Let us know how important these rides are to.
Thank you. Yes, Together Veterans, we're really glad to be able to sponsor that quarterly, and we're really glad to see that it does make a huge difference.
All right. Then the next, with Emily, she's got the 211 phone. So there's the 211 numbers for January. You'll see that we went into a huge decline, which really looks low after seeing the disaster numbers, but, is Emily online?
She is.
Emily, do you have anything else to add?
I don't. Can you hear me?
Yes.
Yeah, I don't have nothing for the 211 phone.
Okay. What about, your update?
My biggest update is how Carrie said, I'm trained with the Narcan training. So if anybody wants any trainings, they can let us know and we can set that up really fast. And other than that, unfortunately, no, I got sick with somewhat mysterious illness that's going around and it's worse than COVID.
Okay. All right. Now that leaves us to any questions? Because otherwise we're moving to Tiffany because she's got her piece today. All right, Tiffany, it's all you.
I sent you a PowerPoint.
Where'd you send it?
To your coordinator. Don't tell me what it is.
No, we go through,
This is, that's the process.
yeah, I know, that's where,
Oh, I was like.
I can get, you can get with me.
If you can't practice, it's okay. All right, good afternoon, everybody. My name is Tiffany Bailey Armendariz. I am the Senior Growth and Community Engagement Specialist for the southeastern corner of New Mexico. So I serve everything, all of the flatlands on the east, up from Tucumcari, Santa Rosa, all the way down to Jam. I am very proud that Molina recognized that the southeastern part of New Mexico needed their own voice. Through the other three, what we call MCOs, the managed care organizations, none of them have community engagement in the southeastern corner. So they're not here, they're not present for as many events. They don't know what exactly is going on. So I'm very proud that Molina has recognized that they need somebody local to be able to understand the challenges that the southeastern corner faces, because we face different challenges in the rest of the state. So I am gonna run through this because there's not a whole bunch of time left. But Molina has care coordination, and through care coordination, they can access what we call value-added services. So our members, they would have to go with care coordination, and this is all based on their needs. And we have extra funds for long-term services and support. So let's say there is somebody who's elderly or disabled, that their house is infested with cockroaches. That is not an uncommon situation. We would be able to provide them with the funds in order to access pest control. We'll be able to provide them with the funds for a ramp or for railings. They do need it, again, they do need to go through care coordination. Another thing that we have are our pregnancy value added services. So they would have access to be able to get a car seat, a crib, a breast pump, etc. Another one that we have is for housing. If somebody is in imminent danger of getting evicted, we will be able to provide them with some funds. You know, the funds are limited in order to prevent them from getting evicted from their home. Or also in order to get them into a home. So we might be able to provide deposit assistance as well. Trying to think off the top of my head which ones we have. Our pregnancy, so at the end of this month, we're gonna have a virtual baby shower for our members online. And that's when they're gonna get all the information on how to access their different value-added services that are available to them and their baby. At the end of March 29th, we're gonna be holding a community baby shower at Eastern New Mexico, Eastern Hospital. And we did one last, I believe it was September, and it was a really good show out. We brought the majority of the home visiting programs came out, and that was amazing. I don't know how many parents came and told me we didn't know that these resources were available to us. Home visiting programs, if y'all aren't aware, are completely free. There is no ifs, ands, or buts. Anyone from undocumented to documented to older, like grandparents that are taking care of their grandchildren up to the age of 3, I believe. So they follow them from pregnancy up to the age of 3. Early intervention does not mean that they have to have some sort of a delay or disability. It is to prevent that from going on too far. They'll be able to say, oh, they're not reaching their milestones of how many words they should be saying. But these pregnancy resource fairs are just absolutely amazing. We're able to also connect parents with parenting classes. A lot of the generational trauma comes from not correcting the patterns that are going on. So these parents are going to be able to access those types of things. So that's going to bring me over to the page that I had handed out. So we know that there are a lot of people in our community that don't have access to reliable transportation. So it is not uncommon for a care coordinator call the member that they didn't miss their dental appointment. Why didn't you go to your dental appointment? Well, my brother who's supposed to take me couldn't get out of work or X reason. We have different types of telehealth. So our first one up here is Brave Health. This is absolutely amazing because it is a telehealth for behavioral. So you'll have access to not just therapists, but med management as well. They are contacted for their first intake within 10 days. In Chavez County, from my experience, it takes at least 3 weeks in order to get your first appointment. So this is amazing, and you don't have to leave your home. I'm very open about mental health. I'm gonna get my daughter's gonna be put onto Brave Health. Both of my children are on Molina. But this is gonna help out because she's gonna be able to, in the middle of the day, go to a classroom that's empty and take her behavioral health. I'm not gonna have to run over there, pick her up, because she goes to early college, run back into town. And so that is a whole bunch of hokey pokey. And we're gonna be able to prevent having kids miss their appointments, and not just kids, but also adults, through this Brave Health. And again, I take my behavioral health on telehealth. Back when I used to work an office job, I would go out to my truck, take my behavioral health, that would be my lunch hour, and come back in, and that was all I was to it. Next down, we have Be Me. Be Me is a behavioral health app geared towards our teens. It is completely free for our teens. It is extremely easy to sign on. In fact, I was like, where does it say that I have to be on Molina? No, it is or my children have to be on Molina. As soon as you put in the name and the date of birth for your child, it's going to go ahead and give you all the options for Be Me. Be Me has a chat bot. They have coaches for these kids, that they're gonna be able to talk to them in a way that the kids understand. I know that as much as, you know, I have a great relationship with my kids, there are gonna be things that they're not gonna tell me. And they need to go to somebody who's a trusted adult. And if that means them getting onto a behavioral health app and getting some advice, then that's okay with me. Because it's better them getting some sort of advice from an adult rather than going to their teenage friends. I keep on telling my kids, the only thing that can make a problem bigger for a teenager is two teenagers. That I dealt with that as a teenager. So you go to your parents, you go to a trusted adult, and they'd be able to help you out a whole lot better than any teenager will. Now on the back, we have Teladoc. Some of y'all might already be familiar with Teladoc. You make an appointment, you sit by your phone, it rings, that's when the doctor's there. There is no sitting in a waiting room. There is no like sitting there in front of your phone. It will be called and you'll be able to speak to a doctor. Again, I'm very, very open. Years ago, I used this for a UTI. I knew it was a UTI. Like it didn't really take very much to know what it was. And I was kind of scared because I was gonna have to take time off of work in order to go to the doctor. When I realized this was an option, I was able to do exactly that. It took 15 minutes like it does in any other doctor's office. You only see them for 15 minutes. And they're able to prescribe the medication over to your pharmacies as well. Now this, and a caveat to this is that if the doctor, you say all your symptoms, the doctor may tell you, you know what, yes, you need to go be seen in physical form with a doctor. But at least it will prevent trying to take extra time off, going into like, especially like right now, like Emily said, there's some sort of mysterious whole type illness that's going around, COVID type illness. And why would you want to go to a doctor's office or something like a UTI and open yourself up to getting sick? Now the next one is UMA. UMA is kind of like a online health doula, but there are also doctors and nurses. This is for our pregnancy moms. They'll be able to call and get information. When I was 8 months pregnant with my son, I freaked out. He hadn't been kicking for a while, and it took me 2 hours on the phone with a nurse provider. I used to live up in a mountain in the middle of nowhere, in order to, you know, get the reassurance that I needed that we weren't going to have to go anywhere. That the community I used to live in, it only had like one little clinic, and otherwise I was going to have to go down the mountain. It was a whole deal. But in this case, they're going to be able to see one immediately. Now our Molina Help Finder. Our Molina Help Finder is like any other resource directory. You'll be able to get onto Molina Help Finder and find the different resources to food insecurities, housing, teen, childcare, etc. So I kind of ran through this. Do y'all have any questions?
Yeah.
Yes.
So behavioral health provider, I'm already credentialed with, they have to get involved in providing services.
I will ask them about that. I will get in, if you give me your information, I will get, our provider engagement team to. Wonderful. I will get my provider engagement team to get in touch with you, because we also, have our care coordinator. We have a couple of care coordinators here in town, and they try to refer the members to local care coordinators, because they know so much more about the local region than somebody from Albuquerque. So that is something, and if anybody knows of a provider that isn't already enrolled with Molina, please let me know. I will get them in touch with our provider engagement team. We just started back into New Mexico last July for our Medicaid. And I guess I was already forgetting these two parts. We also have a Medicare, but you do have to have Medicaid already. And we also have the Marketplace. If you all know of anybody that does not qualify for Medicaid, please have them look at the Marketplace. I looked online and I was kind of upset. I'm paying a whole lot of money for my health insurance, and now I'm realizing that I could have had very, very subsidized health insurance through the Be Well New Mexico. With Be Well New Mexico, there is an open enrollment period, from, sometime in November all the way till January 15th. But there is a loophole. And it does take a little bit longer, though. You have to apply for Medicaid knowing that you're gonna get, denied. And once you get denied for Medicaid, it opens up that opportunity to get into Be Well. But having any sort of coverage is better than having no coverage. I'm sure all of us have been in a situation where we've been sick or our kids have been sick and we hold out till the very last minute because we're not sure if they're just gonna, give your kid a cup full of Pepto-Bismol and send you on your way. So you just kind of wait to see, and that is extremely triggering and stressful. And the same goes for when you're sick. Towards the end of last year, I got sick and I was like, do I really need to go to the doctor? My insurance was a really high deductible. And so I waited it out. And thank goodness I didn't have to go to the doctor and just good old homeopathic stuff, but that is extremely stressful. So being able, and accidents happen as well. They just do. So being able to have some sort of coverage is better than nothing. So Molina does have those 3 different lines of coverage. Are there any other questions?
Thank you, Sybil.
I got a question. Can you hear me?
Yes, Carmen, we hear you.
Thank you so much. That was a great presentation. Thank you. I just want to add something that if you have people that do not have insurance or do not qualify for Medicaid or the insurance pool, please ask them to call UNM Financial Aid Assistant, UNM Hospital, to apply for a program called UNM Care. So I'm going to put the phone number here on the chat. So please also tell your patient or whoever needs insurance, no insurance, but at least to have access to have medical appointments and hospitalization or any type of screening or test, to call this number. And if they qualify, UNM Care will help them. It doesn't matter if they don't have Social Security or they are not from this country. So I'm gonna write down the phone number here. So thank you so much.
Thank you so much, Carmen Gloria. It is really nice to know about more resources so we can help more people. Thank you. Thank y'all, guys.
All right, any other questions? Okay, we had to do things a little different because my Zoom support people are not here, so Dan had to be my spinner, so we went ahead and spun while Tiffany was finishing up. So the winner for the $25 gift card is Marty Garcia, who is online or yay. All right, anybody else have anything before we end? We've only got like 3 minutes. All right, well.
And if anybody else needs those, more of these flyers, I also have them in Spanish as well.
All right, so amazingly, we went through a whole bunch of stuff and ended at 12:58. Thank you, guys. Look forward to emails, information, feedback.
Carrie, I'm gonna keep
Wait,
these and I'll
Carrie,
sign
thank
up on
you.
you. So you don't have to give me.
I would go there. Yeah.
Yeah, I will.
All right, we'll do.